Now with a segment on options for knee pain. Here's our reporter, Laura Windsor.
Roger, treating knee pain always starts with conservative approaches, but when mobility is seriously affected, surgery might be an option. Dr. John Kagan of Lee Memorial Health System discusses the typical patients he sees.
Well, I have several different patient profiles that come in with knee pain. One would be your athletic patient, whether it's a 40-year-old male or female playing tennis or golf or activities such as that. These patients would often come in after experiencing a twisting injury or maybe noticing some swelling and pain in the back of the leg. Another patient that I might have with knee pain might be someone about 60-ish, and they might have arthritis in their knee and have had some pain over a period of time that gradually has gotten to the point that it's interfering with their activities of daily living or interfering with the activities that they want to do.
The types of symptoms can point to the proper course of treatment.
A lot of times the patient comes in with a common complaint like, my knee hurts in the front. My knee hurts when I bend or squat or climb stairs. And those type of problems are usually problems with the articular cartilage that covers the bone. Those are usually pretty much self-limiting problems that get better with a little bit of treatment like some physical therapy, maybe an anti-inflammatory. But sometimes patients come in with pain in the knee and the feeling that their knee wants to give way or is unstable. And you say your knee gives way?
Yes.
Hurts on the inside?
Yes.
Those kind of problems usually are more significant, and those usually represent a meniscus tear or a ligament injury. And those are the problems that we commonly might order an MRI scan. With an MRI scan, you can see a contusion in the bone. You can see edema, indicating a reactive change, maybe from abnormal load sharing. You can see things on an MRI before the patient clinically feels them.
Dr. Kagan discusses the range of treatments.
The treatment options, basically, you can divide them into two things. One is conservative, which is non-surgical, and it might include rest, ice, and then an anti-inflammatory medicine. That's basically the first line of treatment. It might include some physical therapy and exercise. The other would be a surgical problem. So if the problem is one that needs to be taken care of by surgery, probably the greatest advancement in the care of someone's knee pain is arthroscopic surgery. Arthroscopic surgery is minor surgery with small incisions. It's done as an outpatient, usually under some type of an anesthetic. The recovery is quick, not much pain, and for most conditions that we see, the treatment is extremely successful.
If your knee is preventing you from doing the things you want to do, see your doctor. There are ways to get back into the game. For the American Health Journal, I'm Laura Windsor.
For more information about Dr. Kagan or the Lee Memorial Health System's All-Star Total Joint Program, call 239-454-8725 or visit leememorial.org.